To introduce, we can say that since 1928, antibiotics therapeutics property has been demonstrated by Alexander Fleming. And it improved, those properties improved the therapeutic therapeutic control for disease, and it decreased very sensitively the mortality in human and animal population. So the consequences were the widespread use of those antibiotics to prevent and treat disease, the over-prescription by the health professionals, the growth factor in using as growth factor in animal husbandry, and we can see that we have residue in food, in environment contamination. That's why from this time to nowadays, we have antimicrobial resistance in both in human and animal sectors. The consequences of antimicrobial resistance are the ineffectiveness to pathogens, the limitation of the option of these antibiotics, and also the cost expensive, because good antibiotics become not very many. As we can see on this figure, we can see that by 2050, antimicrobial resistance will be the first cause of death in the world. And the part of the world concerned will be mostly Africa and Asia, as you can see in this map. We can ask what will be the world without those antibiotics regarding to their role in to control and prevent disease. In Senegal, we have conducted some activity to raise the awareness of people about antibiotics and their resistance regarding some infection disease. So, activity, we have trained the public and private workers to how to collaborate and address the AMR. So after those activities we have conducted, we propose to conduct a study to see how is the level of those people regarding of their knowledge and attitude regarding the AMR in Senegal. The activity has been conducted at the university and neighborhoods, and we have interviewed 58 persons, and they were from animal health and human health. As you can see, they were veterinarians, physicians, and pharmacists. Regarding to their knowledge about the AMR and also antibiotics, we can see that many of them say that they use antibiotics when they diagnose bacteria. And regarding the cause of the resistance, so we can see that the misuse of antibiotics is the first reason of the resistance proposed by the participants. When we ask them about how they learn about antibiotic resistance, so many of them say that they have learned in schools. And AMR was a part of curriculum in the training curriculum for the workforce, both in animal health and human health sectors. So veterinarian 92%, pharmacists 70%, and doctors, physicians, 72%. Regarding to the practice of those people, we needed to understand how they use the antibiotics, and we can see that if we consider the prescription before a antibiogram, this is prescription before consultation. So many of the people only prescribe the antibiotic only before diagnostic. And then we can see that some of them are giving antibiotics without antibiogram. And here we needed to see how they veterinarians and pharmacists provide antibiotics to communities. And many of them, you can see here that many of them give antibiotics without prescription. So we can reach to the conclusion that the results highlight that the knowledge and behavior of the actors is a risk factor for the development of antibiotics in antibiotic resistance in Dakar. And this shows that we need to strengthen the awareness and education for the stakeholders, and develop research to prevent and control antimicrobial resistance in our countries. Thank you for understanding.